Hello everyone, thank you for your time. My name is Karar Al-Jabouri and this is a presentation on a surgical instrument concept to build a mechanical in-situ rod bender. A little bit about the relevance of the instrument in the operating room. In spine surgeries such as laminectomy and fusion, longitudinal rods are placed along the spine to stabilize it. In-situ rod benders, they are used to bend the rods to match the curvature of the spine. And here I have some pictures to show the basic anatomy of the vertebral column. Here on the left I have a lateral view of the spine. This is the superior aspect, this is the inferior aspect, and this is anterior and this is posterior. And we can see the curves of the spine. This is the lumbar lordosis and this is the thoracic kyphosis. Here on the right, I have a superior posterior view of the vertebra, and the key anatomical areas that I think are relevant to this presentation are the vertebral body, the pedicle, the lamina, as well as the spinous process. This is an overview of the basic concept of the operation. Here I have a picture of the spinal column, and this is a posterior view, and I also included this picture again for better correlation and clarification. The operation involves the removal of the lamina and the spinous process. This is the spinal canal where the spinal cord is housed, and after the removal of this portion, the spinal cord is going to be exposed posteriorly. The pedicle screws are going to be inserted from the posterior aspect, and they go through the pedicle, and they settle in the vertebral body anteriorly, and this happens on the left side as well. Translating these steps onto the picture on the right, here I have the pedicle screws in red, and I also have the rods in blue. And this is the portion of the bone that's removed. This is the lamina, and this is the spinous process. And once again, the pedicle screws are going to be inserted from the posterior aspect here, 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 and here. And also these two pedicle screws and the rods in blue are going to be inserted, and they sit within the heads of the pedicle screws, and then depending on the curve desired, the in-situ rod benders are going to be used to bend the rods. Here I have a cartoon picture showing the rods and the screws, and you can tell that these are the pedicle screws and this is the rods sitting within the pedicle screws. And here I have an actual x-ray of a lumbar laminectomy and fusion, and these are the pedicle screws. This is the vertebral body. And as you can see, the spine is curved this way, and this is the rod sitting within the pedicle screws, and the in-situ rod benders would be used to bend the rod this way or this way. Current in-situ rod benders are instruments that are made of a jaw and a handle. And here in this picture we have a rod that is placed horizontally, and we can see that the jaw is used to grab onto the rod. The surgeon would apply the force laterally in this case, and it would bend the rod downward. This could be a physically demanding task. It could also introduce the risk of slippage when applying high forces, and it could also be a time-consuming process. This is a picture of a plastic model of a surgical instrument concept that is mechanically operated. And this instrument heavily relies on two principles. The first one is applying the force through a bolt, and also the lever principle, and having a longer handle is going to help the surgeon apply less force to achieve the same results. And the bolt, as we can see, is attached to a moving arm, and there's also a stationary arm. And this is a close-up picture of the arms, and they end with a jaw, and the jaws will be able to grab onto the rod. When the bolt is rotated clockwise, it is going to force the moving arm downward, and this would bend the rod downward. And likewise, when the bolt is rotated counterclockwise, it's going to force the moving arm upward, and that's going to bend the rod upward. When rotating the bolt, it is important that the moving arm does not spin, and this is achieved by using a pin that sits within a groove at the head of the moving arm. And so when the bolt is rotated, this would help the moving arm to stay still. And when applying the force, this handle is used for stabilization and also preventing torsion when the bolt is being rotated. And these two pictures demonstrate the vertical motion of the bolt. Here on the left, we have the bolt being rotated clockwise, and this would push the moving arm downward. And assuming that we had a rod that was laid horizontally within the jaws, this would bend the rod downward this way. And here on the right, we have the bolt being rotated counterclockwise, and this would bend the rod upward, assuming that the rod was laid flat likewise. The tilting action of the instrument would allow the surgeon to adjust the angle or the level at which he wants to bend the rod, and this shows that the moving arm can be brought really close to the stationary arm, as we can see over here, to have a bending location that is really close to the stationary arm. But also the bolt can be tilted this way, and this would increase the distance at which the surgeon wants to bend the rod. And also, the moving arm can be rotated, as I mentioned earlier, 360 degrees. And here we have the sliding action of the bolt, and it actually accentuates the tilting action of the bolt. It increases the maneuverability of the instrument, and this would help provide a variety of bending points along the rod. And here we have a zoomed in picture of the moving arm sitting within the bolt, and also we can see the pin over here that sits within a groove at the head of the moving arm. And this would allow for the 360 degrees of rotation. All the pictures used in this presentation are public domain pictures, and I have the links for them over here. And if you have any questions, please ask away.